The next speaker, Dr. Rashmin Gandhi, who will be speaking on leadership in ophthalmology, the processes and evolution.
Thank you, ARC. I know that we are running way out of time, so I'm just going to take maybe 3 or 4 minutes and wanted to highlight one example which I found it very motivating. I have a unique position right now to be in an organization which is already at a very advanced level, to be part of it, and plus to be part of a couple of startups which we ourselves are managing. And I can clearly see that the leaders, the way they think when you have an established organization versus a startup, there has to be a difference, there would be a difference, and sometimes amalgamation of both is something which would work out. But what I wanted to highlight, what I found really motivating was this. So this is about a person, a leader in ophthalmology.
So before he starts, I must introduce that he is a neuro-ophthalmologist of international repute in Hyderabad. So he is a big man, and he is talking on something other than neuro-ophthalmology. So you must have all ears to him. Thank you.
Thank you, Sudhaj. I have become a little big right now. But so this is about a person who from a developed country was posted actually first to Ghana and then to India and to Rangoon. I'm sure a lot of us would have lost a morale and said that, oh, what is this being done? So when he went to first he went to India and Rangoon, and he was treating soldiers who were really affected by the war. And during that period of around 18 months, he realized that a lot of these people had optic nerve problem. They were not able to see too well. And in his observation, if they ate well, they became all right. So this big person who we all know was probably one of the first one to say that there is a toxic or a nutritional optic neuropathy which can be corrected. From cut to there, he went to Ghana. A lot of river blindness there. Again, that was not his core area, but he kept looking at those patients which river blindness. And this fundus, which has become a very famous drawing, it is his own drawing, and that goes by his name. I don't know whether any of you have guessed as to who we are talking about. If not, then this is probably will give you a clue. This is an article which appeared about George Cleaver, who was a fighter pilot at RAF in the World War. And he was one of the first patients of our person who realized that though he lost his eye, but whatever perspex which had gone in his eye, it did not cause any reaction. So any idea who we are talking about? Yes, we are talking about Ridley, and it's so surprising that he was the one who actually described nutritional optic neuropathy, and he drew this fundus which is now called Ridley's fundus. So process, I was asked to talk about the process, and this I thought was amazing. Process for self. What are the processes which are available for you to go into leadership role? What I thought here was ability of him to analyze clinical data and consider best interests of the patient, and a problem which was an affliction of many, his tenacity to really solve this problem. A last point, while he did all this, he implanted the intraocular lens, and Duke Elder, who was one of the best during that period, actually thought that that's not a good idea. And I mean, what are you doing? We are doing surgery, which is great. Patients are happy with contact lenses, and doing or implanting intraocular lens in these patients are going to actually harm the patient. He did not really stop. Dr. Ridley did not stop. So apart from pursuit of perfection, indomitable will to make a difference, he also had this very important characteristic of tenacity. He believed that he's going to make a difference, he's going to make an impact, and carried on. I thought that's a process for leadership. Thank you.